I am excited to share that the Ontario government has announced that it is taking steps to expand the scopes of practice of several regulated health professions, including registered practical nurses. The goal is to remove a number of outdated barriers to practice that unnecessarily restrict healthcare providers from using their full knowledge, skill, and competencies, and make it harder for patients to receive timely, quality care. The timing of this announcement is especially important given the government's ongoing efforts to shift care when appropriate closer to people's homes and communities. Enabling our interprofessional teams of healthcare providers to optimize their practice in keeping with their ever-evolving education will improve patients' access to quality care in all healthcare sectors. There are several changes proposed that will specifically expand RPN practice. When these changes are implemented, patients will be able to receive the wound care that they need from an RPN with specialized wound care knowledge in a timely fashion as their wound care needs change. RPNs will be able to initiate irrigation, probing, packing, and debridement of wounds at the time that they assess that these procedures are required to optimize wound healing, rather than communicating their assessment to another provider and waiting for an order. We have heard from RPNs that these delays in treatment can actually lead to worsening of a patient's condition, so it is indeed good news that patients will be able to receive this care as soon as it is needed. Of course, some wounds will continue to require collaborative care from a team of wound care experts. In a similar fashion, RPNs will be able to initiate IV access and maintain patency in certain situations when a delay would be dangerous for the patient, rather than waiting for an order to start the IV. This will be a significant improvement for patients living in rural and very remote areas. Two other changes relate to the Controlled Act regulation about the insertion of instruments, hands, and fingers into body openings in order to provide care. RPNs will be able to provide more complete and timely assessment and care to patients once these regulatory changes are made. RPNAO is looking forward to working with the Ministry of Health and Long-Term Care and our nursing partners during the assessment process. We firmly believe that these changes to RPN scope of practice put patients first and that they will result in more timely, quality care for Ontarians.